If you can do this with your thumbs, you probably have hypermobile joints. And if you're dealing with wrist or hand pain that won't go away despite seeing multiple doctors and trying traditional physical therapy, I'm going to show you exactly why those approaches fail. I'm Dr. Elliot, a physical therapist and repetitive strain injury specialist. I train hypermobile wrists and hand all day long, but here's what most people don't know. I also have hypermobile thumbs myself. As a physical therapist, I perform 7 to 8 hours of deep tissue work daily. My thumbs take a beating, and if I don't do a specific routine, the exact same routine I prescribe to my patients, I start getting pain radiating out my forearms by the end of the day. But because I do this routine 2 to 3 times per week, I can work 10-hour days without pain. I can rock climb on the weekends, and my hands feel better now than they did 5 years ago. Most physical therapists don't have the conditions they treat, but I do. And in this video, I'm going to show you the exact exercises I do to keep my hypermobile thumbs functional. The same protocol that's worked for hundreds of my patients. And at the halfway point, I'll demonstrate my complete routine step by step, including the specific technique I use to make high rep exercises actually effective. So stick around for that. Let's dive in. First, let's talk about what hypermobility actually is, because it's not just being flexible. Your joints are held together by 2 completely different systems, and understanding this is critical to understanding why you're in pain. System 1 is what we'll call passive stability. These are your ligaments. They're thick, rope-like connective tissues that connect bone to bone. They provide structural support 24/7 without you even thinking about it. Think of them as your joint's foundation, or armor. System 2 is active stability. These are your muscles and tendons. They actively contract to control joint movement, but they require energy and they fatigue with repeated use. Think of them as workers that need to be trained and conditioned. Here's where it gets interesting. In someone without hypermobility, the ligaments do about 70% of the joint stabilization work during normal activities. The muscles and tendons only provide about 30%, fine motor control and occasional support. But in someone with hypermobility, whether you were born with it or it was developed through injury, this ratio is completely flipped. Your muscles and tendons are doing 70 to 80% of the stabilization work because your ligaments are loose and aren't providing the foundation they should be. And here's the permanent reality that most doctors won't tell you clearly. Ligaments do not tighten back up. Unlike muscles and tendons, which we can strengthen dramatically, ligaments have very limited blood supply and almost no healing capacity. Once they're stretched beyond their normal length, they rarely return to their original tightness, unless you opt into extreme interventions like surgery or biologics injections, which are rarely performed for this purpose and have very mixed results. So when a doctor tells you to rest or puts you in a brace, they're not addressing the actual problem. You can't rest your way to tighter ligaments. By the way, this advice only applies to ligaments that have been stretched and the healing is settled. If you sprained your ankle, bracing is a way to have the ligament heal in a shortened position. Now, there are 2 ways you can end up with hypermobile joints. The first type is genetic hypermobility. Some people are born with connective tissue that produces looser or more elastic collagen, and this exists on a spectrum. On the mild end, you might just have a few joints that bend further than normal, common in the thumbs or the wrists. You might have noticed this as a kid when you could do party tricks with your fingers. In the middle, there's something called hypermobility spectrum disorder, or HSD for short. With this condition, multiple joints are affected. You might have some fatigue or joint pain, but it doesn't significantly impact your daily life. On the more severe end, there's Ehlers-Danlos syndrome, or EDS for short. This is a systematic connective tissue disorder with various subtypes. The most common is hypermobile EDS, or HEDS for short, which significantly impacts quality of life if not properly managed. Here's a quick self-check. If you can do 5 or more of these movements, you likely have generalized hypermobility. Can you bend your thumb back to touch your forearm? Can you bend your pinky back beyond 90 degrees? Can you hyperextend your elbow beyond 10 degrees? Can you hyperextend your knee beyond 10 degrees? And finally, can you bend forward and place your palms flat on the floor with straight legs? If the answer to 5 or more of these questions is yes, left and right both count as a point, you may have EDS. The second type is acquired hypermobility. Your ligaments can also become loose through repeated microtrauma from poor posture, previous injuries, and especially if you've sprained your wrist or thumb. Chronic overstretching from activities like yoga or gymnastics also play a role, and even things like inflammatory conditions can cause you to have looser ligaments. In my case, it's a combination. I was born with HSD and somewhat loose thumbs, but years of martial arts, specifically grappling, sprained and stretched those ligaments even further. So now I'm dealing with both genetic and acquired hypermobility in the same joints. Now here's where this should really click. We use something called the Healthbar Framework to explain repetitive strain injuries, and hypermobility makes this like playing a video game on hard mode. You have to grind more HP in your muscles and tendons to handle the missing armor your joints have. Think of your muscles and tendons like a health bar in a video game. Every activity throughout the day drains some HP. When you hit 0, you experience pain. Let's compare two people doing the same 8-hour workday at a computer. Person A has normal joint stability. Their ligaments handle 70% of stabilization, while their muscles and tendons only provide 30%. They burn about 10 HP per hour for a total daily cost of 80 HP. Person B has hypermobile joints. Their ligaments only provide 30% of stabilization, which means their muscles and tendons must provide 70%. Every single keystroke requires more muscular effort. They burn about 18 HP per hour for a total daily cost of 144 HP. That's 80% more HP drain for the exact same activity. If both people start the day with 100 HP, person A finishes at 20 HP. A little tired, but no pain. Person B hits 0 HP after just 5.5 hours and spends the last 2.5 hours in pain. This explains everything. It explains why your wrist pain gets worse faster than your colleagues. It explains why ergonomic changes help, but don't fully resolve symptoms. It explains why you feel weaker than others. You're not weaker. Your joints just demand more from your tissues, and it explains why rest helps temporarily, but pain returns quickly when you resume activity. The traditional approach says, let's reduce your HP loss. Let's rest more, use a brace, change your ergonomics. But that's like trying to beat a level 50 boss with a level 10 character by just being more careful. Eventually, you're gonna lose. The real solution? Level up your character and increase your maximum HP. Now, before I show you the specific exercises that changed everything for me, and the exact routine I still use to manage my hypermobile thumbs, I want to mention something here. If you're watching this and you're recognizing yourself, you've seen multiple specialists, your images show nothing remarkable, or mild changes that don't really match your symptoms, you've invested in ergonomics, and you've tried standard physical therapy, but you're still searching for answers? Well, we offer free 60-minute consultations where we do a comprehensive functional assessment. We'll look at your specific hypermobility pattern, your actual tissue capacity versus your daily demands, and why your previous treatments didn't work. There's no pressure. Plenty of people we talk to aren't ready for intensive coaching, and we tell them that directly. But what you will get is clarity, something that's been in short supply if you've been through the traditional medical system. The link is in the description below. We work with people all over the world through virtual consultations. You don't need to be in the same city or even in the same country. Alright, now let me show you why the standard physical therapy approach completely fails for hypermobile joint. Most physical therapy programs focus on one thing: strength, which is maximum force production. How much weight can you lift? But for hypermobile individuals with repetitive strain injuries, endurance is 10 times more important than strength. You don't need to be able to get your wrist to curl 50 pounds. You need to be able to type for 8 hours without your stabilizing muscles fatiguing. Here's the standard physical therapy protocol. 3 sets of 10 reps with moderate resistance. And this approach builds type 2, which is fast twitch muscle fibers, which are great for strength, but terrible for endurance. And the results? Slight improvement, but symptoms return with prolonged computer use. In order to do repetitive actions for long periods of time, you need to build the muscle and tendon endurance, and this is done with low weight and high reps. Think of marathon training versus powerlifting. Those type 1 endurance fibers need to be robust enough to handle your long sessions of repeated activity with your hands. The correct approach for hypermobility is 3 sets of 20, or 60 consecutive reps with light resistance. We also use isometric holds for 45 seconds. This builds type 1 slow twitch muscle fibers through progressive overload of time under tension, not just weight. The results are a substantial increase in endurance capacity. Now, I know what you're thinking. This sounds great in theory, but does it actually work? Let me show you proof. And I'm not just talking about my patients. I'm talking about myself. So here's my situation. As a physical therapist, I spend 7 to 8 hours a day doing deep tissue myofascial work. My thumbs are constantly stabilizing against resistance, providing deep pressure into tight tissues, doing instrument-assisted soft tissue work. It's basically one long isometric thumb workout. And I have hypermobile CMC joints, the joint at the base of both thumbs, partly genetic and partly from years of martial arts. Now, because I treat this condition all day long, I knew exactly what would happen if I didn't maintain my tissue capacity. When I assess a patient's wrist extensor endurance and they can only do 30 reps before fatigue, I know that's not enough capacity for 8 hours of computer work. Their hypermobile joints are demanding way more from their muscles and tendons than they can currently provide. Same with me. If I let my endurance slip, which I've tested by the way, unfortunately, around the 6 or 7 hour mark of work, I start getting that deep aching pain in my thumb extensors, these muscles on the back of my hand and forearm. By hour 8, it radiates up into my forearms. My thumbs feel unstable and fatigued. It's the exact same presentation I see in my patients, just triggered by manual therapy instead of typing. But because I do this routine 2 to 3 times a week, the same routine I prescribe to my patients, I can work 10-hour days without pain. I can rock climb on the weekends, and my hands feel better now than they did 5 years ago. These are the exact exercises I do to keep my thumb endurance high. If you were just starting from scratch trying to rehab this, you may want to introduce these in phases. First, in phase 1 is thumb stretches. I do a thumb flexor stretch and a thumb extensor stretch, 30 seconds each, for 3 sets. Just because your joints are hypermobile doesn't mean your muscle length is good. Tired and irritated muscles tighten down as a protective response, and tight muscles don't contract efficiently, so I start by stretching them. Then in phase 2, I do isometric foundation work. Exercise 1 is the isometric thumb flexion hold. I press my thumb against resistance in a mid-range position and hold for 45 to 60 seconds, for 3 sets per thumb. This builds baseline endurance without aggravating the joint. Exercise 2 is the thumb extensor isometric hold. I hold my thumb in extension against resistance for 45 to 60 seconds, for 3 sets. And this addresses the thumb and forearm fatigue I get from manual work. Then in phase 3, I move to high rep endurance work. Exercise 4 is thumb extension with a band. I use a light resistance band for 60 reps with a controlled tempo using a metronome at 50 beats per minute. This is the money exercise. This builds massive endurance capacity. Exercise 5 is a stress ball squeeze at about 70% of my max grip strength. I hold for time, 5 seconds on, 1 second off for 60 reps. The grip endurance is critical for my manual therapy work. The difference this makes is significant. In Healthbar terms, my daily work demands about 120 HP. Without this routine, my maximum capacity drops to around 100 HP, so I'm going into the red by the end of the day. With this routine maintained, my max HP stays around 180 and my efficiency has improved, so my work only drains about 90 HP. Same job, same hypermobile thumbs, just a bigger health bar that I actively maintain. This is why I'm so confident in this approach. I'm not theorizing here. I prescribe these exercises all day, then I go home and do them myself. When patients ask me if this really works, I can show them my own thumbs and tell them yes, absolutely, because I depend on it. And this is the same protocol that's helped hundreds of people with hypermobile joints get back to pain-free work and hobbies. Let me give you a real example of why this works. I worked with a senior software architect, we'll call her Sarah, who had hypermobile wrists and thumbs. She'd been through 18 months of the healthcare system, and here's what didn't work. 2 orthopedic consultants who said, wait and see, an MRI showing mild tendinosis and a mildly torn scapholunate ligament, which was an old injury that didn't explain her symptoms, 3 months of standard physical therapy with 10 rep protocols, over $1,200 in ergonomic equipment, and 2 cortisone injections that provided only temporary relief. Her doctors kept telling her that the imaging didn't match her pain levels, and she was beginning to question whether or not this was just something she'd have to manage forever. So here's what changed. When we assessed her mobility, she scored a 6 on the Beighton scale. When we looked at her wrist extensor endurance, she could barely complete 30 reps before fatigue set in. Her hypermobile joints were demanding 3 to 4 times more from her tendons than the average person, but no one had measured or addressed her actual capacity deficit. After 16 weeks on her endurance-focused protocol, her results were dramatic. Her pain reduced from 6 out of 10 daily to 0 out of 10. She could code for 10 plus hours comfortably. Her wrist extensor endurance increased from 30 reps to 120 reps, and she was back to rock climbing on the weekends. The key difference here? Her imaging was never going to tell the full story. Her hypermobile joints created a capacity deficit that could only be measured functionally and addressed through specific endurance training. Based on working with hundreds of people with hypermobility and repetitive strain injuries, successful recovery requires 5 core elements. Number 1 is general endurance training. You need to build the capacity of your tissues to handle the demands of the activity you are doing. Number 2 is graded exposure. This means gradually increasing activity to expose yourself to safe levels that may cause some pain. This doesn't mean avoiding all activity. It means intelligently managing your load while you build capacity. You're not protecting damaged tissue, you're training under conditioned tissue. Number 3 is pain reprocessing. This means understanding why the pain is happening and why you're safe using your hands for specific durations. When you understand that pain at 5.5 hours means capacity reached and not tissue damage, you can work with it more effectively. Pain is an alarm system, not a damage detector. Number 4 is consistent pain education. Continued learning about pain science creates better understanding during situations when symptoms are elevated. This is especially important during the inevitable flare-ups that occur during capacity building. Knowledge reduces threat perception, which reduces pain. Number 5. You shouldn't be alone in this process. Guidance from a provider who understands pain and can help you reframe specific situations is essential. While it's possible to resolve issues on your own, it can be challenging to process pain appropriately, especially with hypermobility, where the relationship between capacity and demand is more complex. This framework helps people reduce their sensitization over time and build confidence in using their wrists and hands, not just for work, but for hobbies and life activities. Alright, let's wrap this up with some key takeaways. Number 1, hypermobility means your muscles and tendons do 70 to 80% of joint stabilization, versus 30% in normal joints. Number 2, this creates dramatically higher endurance demands for repetitive activities. Number 3, Standard strengthening programs fail because they build the wrong type of muscle fibers. Number 4, you need high rep training, 30 to 60 plus reps with low resistance and controlled tempo to build slow twitch endurance fibers. Number 5, recovery is absolutely possible by building a larger health bar capacity. I use this exact same protocol myself. And number 6, imaging often looks normal because the problem is functional capacity, not structural damage. Your hypermobile joints aren't a defect. They're a variable that requires a specific approach to conditioning. The traditional healthcare system operates on protocols designed for the average patient. When you combine hypermobility with high-level desk work demands, you fall outside those protocols. The difference between continued struggle and resolution comes down to whether someone has accurately measured your capacity deficit and knows how to close that gap systematically. If you're watching this and seeing yourself in what I've described, you've cycled through multiple providers, your imaging doesn't explain your symptoms, you've invested in solutions that haven't worked, and you're still searching for answers, I want to offer you something. We built a comprehensive functional assessment specifically for people dealing with hypermobility and repetitive strain injuries. In 60 minutes, we'll analyze your specific hypermobility pattern and how it affects your activities. We'll review your previous imaging and interventions to understand why they didn't work. We'll measure your actual tissue capacity versus your daily demands, and we'll give you a realistic timeline for recovery and what level of commitment is required. We'll also determine whether our coaching program is the right fit for your situation. This assessment is completely free, there's no pressure, we work with people from all over the world virtually. What you'll walk away with is clarity. You'll understand exactly what's happening in your body, why previous treatments failed, and what needs to happen for you to recover. Even if you don't work with us, you'll have a roadmap. And sometimes that's all people need to get unstuck. The link is in the description below and in the pinned comment. I hope this video gave you some insight into why hypermobility makes repetitive strain injury recovery so challenging. And more importantly, that recovery is absolutely possible with the right approach. If you found this helpful, hit that like button. Subscribe for more content on repetitive strain injuries and hand pain. And drop a comment below with your experience with hypermobility. Thanks for watching, and we'll see you in the next one.